How is the Spanish flu pandemic similar and different than COVID-19? Let's jump into the similarities, addressing two main points. The first point being slow reaction time. To be frank, the U.S. was slow in its response and approach to both the 1918 Spanish flu and COVID-19. During the Spanish flu pandemic, the U.S. did not enforce public policies until mid-fall, which was months after the virus's spread. Sadly, the U.S. did not learn from their previous mistake and did not enforce public policies until mid-March, while the virus made its way over sometime in January. It was apparent in both pandemics that America was hesitant to escalate the stringency of its public policies, specifically school closures, public gathering cancellations, social distancing, and mask requirements. If the U.S. was faster and more strict in its grand approach to tackle the 1918 Spanish flu and COVID-19, imagine the millions of lives that would have been saved. Now let's jump into the second main point. The human toll is higher among African Americans. Further adding to the position that the U.S. handled corona in a bad way, history is repeating itself. Like in 1918 during the Spanish flu, society, the government, and the healthcare system failed to empower specifically Black people, which is also the case for today with COVID-19. The coronavirus appears to be killing African Americans in a higher number than any other race. According to the CDC, 2020, compared to white non-Hispanic persons, Black or African Americans have 2.6 times the number of coronavirus cases and 2.1 times the number of deaths. Of course, with race and ethnicity, there are risk markers for other underlying health conditions such as high blood pressure and heart disease that make African Americans more susceptible. However, overall, these pandemics have revealed racial inequities such as their socioeconomic status, access to health care, and increased exposure to the virus due to occupation. All in all, the U.S. has left African Americans to fend for themselves once again. Now let's jump into the differences. In 1918, government officials pretended the pandemic did not exist. As the death toll skyrocketed in 1918, public officials were almost completely silent. Local medical officials understood what was happening but simply did not get attention from the broader nation. Attention seemed to only be on the war at the time. In contrast, in 2020, government officials did not pretend as if a pandemic was not occurring. Precautions and protocols were placed out as soon as numbers started to pick up, but not as quickly as they should have, like mentioned before. Now let's talk about resources then versus now. Compared to 1918, the most obvious difference is the higher caliber of resources at America's disposal. Higher-end medical practices, medicines, and more structure. Although in 2020 the U.S. has things like such at their disposal, thousands of lives were still lost. The U.S. simply was not prepared enough nor quick enough. All in all, America doubted the severity of COVID-19 like it did in 1918.
The Spanish flu in 1918 is reported to be the most deadly pandemic in history. The number of deaths worldwide are estimated to be at least 50 million people. Its name originated from Spain because it was the only country for a while to actually report the outbreak of this virus, while other countries downplayed the seriousness of its effects, and where the virus originated from is still unknown. Similarly, in the U.S., government officials proclaimed that COVID-19 was nothing to worry about and that it was contained. Prior to the massive outbreak, health officials warned the president about the dangers of this current pandemic, and still few politicians held on to the idea that it was overhyped. During the Spanish flu pandemic, Wilmer Cruzan refused to cancel the Liberty Loan Parade that was expected to attract several 100,000 people and insisted it must go on to raise millions of dollars in war bonds. 72 hours after the parade, all Philadelphia hospitals were full and 2,600 people were reported dead by the end of the week. The parade threw the gasoline on the fire, considering the infection rate had already been increasing. During the Spanish flu, it was made law to wear a mask, and those who did not comply or were caught wearing their mask improperly were arrested with disturbing the peace and fined $5. Unlike the current pandemic, wearing a mask was not made law in the States until May, June, or July, depending on the state. Even though the first confirmed case of coronavirus was confirmed in January and spread like wildfire for months February to May. Our recent quarantine and lockdowns were not strictly enforced, and the people continue to carry on with their lives without punishment. With safety guidelines not being followed, this forced stay-at-home orders to be lengthened. During World War I, U.S. troops carried the Spanish flu, but the U.S. wasn't allowed to report it because it could possibly harm war efforts. It was also covered up in fear that our enemy countries would find out we were suffering an outbreak. The 2020 U.S. government did report the outbreak as a number of COVID-19 infections became more serious, but some did not consider the effectiveness of a mask as useful, causing the infection rate to skyrocket. An immunologist claimed that people shouldn't be wearing masks because it puts them more at risk to be infected. He suggests that it puts them more at risk because it causes them to touch their face more often. And another politician suggested that masks are not effective and it puts communities at risk. Different communities refused to wear masks and then protested the laws put in place, which did not help the number of people coming in contact with COVID-19. We now know that these statements are deemed incorrect because of the science used to prove that wearing a mask was the best way to resist becoming infected. In 1918 and today in 2020, minority communities are suffering from higher death rates at the cause of these viruses. And the Black community, yet again, gets the short end of the stick in coronavirus relief. Racial inequalities both then and now affect the kind of healthcare they are provided, therefore making them more likely to not be treated properly.
One of the things that could have been done differently during the COVID-19 pandemic would be that in the state of New York, a state where COVID-19 hit very hard, the governor, Andrew Cuomo, should not have sent COVID-19 positive patients to nursing homes after those nursing homes had stated that they were not ready for COVID positive patients. The New York Department of Health released a document on March 25, 2020, stating that no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. Instead of putting the positive patients into a place full of people who are considered more at risk to get COVID-19 and likely die from it, the USNS Comfort, which was docked in New York, could have been utilized better to its abilities, and those overflow patients could have been treated there rather than at a nursing home, putting more people at risk.